Hello everyone. In our 2-minute revision lesson today, we shall be revising the key study from the unit Obsessive Compulsive Disorder by Lovell et al. 2006. This study addressed a critical question in clinical psychology. Can cognitive behavioral therapy, CBT, for OCD be delivered by telephone and still be as effective as traditional face-to-face sessions? Since CBT is time-consuming and expensive, waiting lists for therapy are long and symptoms may worsen while patients wait. Lovell et al. Aim to test if telephone CBT could be a more accessible and efficient alternative. The researchers carried out a randomized controlled trial comparing face-to-face CBT and telephone-based CBT. Both groups received 10 weekly sessions. The sample included 72 OCD diagnosed participants aged 16 to 65 from 2 UK outpatient clinics. All participants scored at least 16 on the Yale-Brown Obsessive Compulsive Scale, YBOX, and were randomly assigned to either treatment condition. Therapy was conducted by 2 experienced clinicians using manualized protocols, and participants were assessed using the YBOX and Beck Depression Inventory, BDI, at 5 time points, before, after, and 1, 3, and 6 months post-treatment. Importantly, the researchers assessing outcomes were blind to group assignments, which reduced bias. Findings showed that both telephone and face-to-face CBT were equally effective. At each of the 4 post-treatment assessments, participants in both conditions showed significant reductions in OCD symptoms, with an average drop from a YBOX score of 25 to much lower levels. In fact, 77% of telephone participants and 67% of face-to-face participants showed clinically significant improvement. Additionally, both groups reported high satisfaction with their treatment experience. Lovell et al. Concluded that telephone-delivered CBT can be just as effective as traditional in-person CBT, while offering more convenience, accessibility, and reduced costs. This finding is particularly important for increasing mental health service reach, especially for those who face barriers to in-person therapy. Dear students, remember the resource is always here for a quick, easy revision whenever you need a boost. I hope this was helpful. Thank you.